Hi everyone, Nurse Farynheight here. Thanks for tuning in to another episode of Best Damn Self. Make sure you subscribe below if you have not already, and also turn your post notifications on so you're aware of every single video I post every single Wednesday. Medical situations can be super scary, and sometimes it's confusing on whether you should go to the ER or urgent care. So today I'm gonna help you figure out which one you should go to in a medical situation. First things first, urgent care is for minor situations. It is not for life-threatening situations, okay? Urgent care is for minor situations, and it focuses on conditions that are not life or limb threatening. But you do want to make sure that you do get immediate care within 24 hours. So what can you expect when you go to an urgent care? When you go to an urgent care center, you will find doctors and physician assistants who most likely have expertise in emergency or family medicine. With this knowledge, they're able to treat people of all ages with all different kinds of illnesses, and they're also able to determine whether you do need to go to the emergency room. So you may ask, what may you find at an urgent care center? So if you go to an urgent care center, you may be seen by the doctor very quickly, whereas if you were to go to the ER, you may be waiting a little bit longer, and that's because they prioritize people off of the severity of their condition. Since it's very different from the ER, you're not going to see a lot of the equipment that you would normally see in a hospital. But they do have basic things such as x-rays, things to splint bones, things to drain abscesses, little things like that. They have swab tests where they can determine whether you have strep throat or the flu. So they have basic equipment. They don't have all the things that the hospital does have. Now, of course, this all determines on your insurance, but typically urgent care is way less expensive than going to the emergency room. So by now you're probably saying, okay, what are the signs that I should be going to urgent care? So I'm gonna get right into it. So first things first, you're gonna wanna go to an urgent care if you are not in a life-threatening situation or it's not life-threatening to any of your body parts. Some examples may include if you have pink eye, you might have a UTI, you might have twisted an ankle, you might have some ear pain, or say that you're cooking something and you accidentally cut your finger. As long as there's no bones showing or there's no blood spurting and it may not be able to be covered by a Band-Aid, you're gonna wanna go to an urgent care. All right, so you might go to the urgent care if you have what seems to be a minor bone fracture, because urgent cares, they can actually diagnose and splint them for you. If it is a long bone fracture like the arm or the leg or the back, you would want to go see the ER. But if it's something like the wrist or your finger or your ankle, that's where you would want to go to urgent care. You may also go if you have a cold or a flu that's not responding to treatment. As we know, these things can be easily treated at home, but if symptoms aren't going away and you feel like you might be getting pneumonia, that's when you can come to an urgent care. You may also want to go if you're having chest pain, are under 55, and think it may be a cause due to a strenuous workout. For example, if you have pulled a muscle at a gym and you feel like you lifted too much or are having chest pain from heartburn, then you should go to an urgent care. So now let's get into what are some of the reasons you may be going to the ER. If you are having trouble breathing, you need to go to the ER. This can be due to an allergic reaction. You may feel like your tongue is swelling up or your throat is closing. So if you are having difficulty breathing, you're always gonna wanna go to the ER for sure. And don't forget, if you are having shortness of breath, it could be due to a heart attack as well. So you're gonna wanna get checked out as soon as possible. Do not wait. If you are having signs of sudden paralysis, trouble speaking, confusion, or other strange symptoms, you are gonna wanna go to the emergency room because these are all signs of a stroke. At this point, you should definitely call 911. Emergency rooms have access to CT and MRI machines, which can diagnose what's going on in your situation. So you're also gonna wanna go to the ER if you're having a fever or severe stomach pain, or you're having symptoms like nausea, vomiting, or increased swelling in your stomach area. A mix of these symptoms can signal a lot of stomach conditions that may need emergency care, such as appendicitis, a gallbladder attack, or pancreatitis. Last but not least, you're gonna wanna go to the emergency room if you're dealing with an illness or injury that may be life-threatening or limb-threatening. So you may have a deep wound that won't stop bleeding, or you feel like you have broken a major bone, or generally you're just experiencing symptoms that you've never experienced before. You're gonna wanna go to the emergency room. So I wanna leave you guys off on this one important note. If you feel like you do need to go to the urgent care or the emergency room, do not put it off simply because you feel like it's gonna cost too much. Yes, the cost in the US is super expensive, so I definitely understand why people may be intimidated by the cost, but it's super important to go when it's needed. In most situations, you can definitely negotiate your medical bill and pay them off as time goes by, so do not let the cost hinder you. Thank you guys for tuning in to another episode of Best Damn Self. As you already know or should know, I'm Nurse Farynheight. Make sure you subscribe below if you haven't already. Make sure you turn the post notifications on. I will be posting a video every single Wednesday. Also, make sure you follow me, Nurse Farynheight, at Nurse Farynheight, and follow Best Damn Self on Instagram at Best Damn Self. Signing out.